In clinical practice, rheumatism is a big number of patients that come to us are with the complaints of some rheumatic problem or the other. The commonest being rheumatoid arthritis. And we being a tropical country, we have these cases in rise very often in the rainy season and the winter season. Okay. Apart from that, the food habits and the prevailing socio-economic condition also lead this disease in the maximum number of patients coming to our clinics. In homeopathy, we have an edge in treating these cases because quite a sizable number of patients are very sensitive to the modern medicine in terms of gastric reactions or intolerance to the medicines or the molecule that they use. Secondly, long-term use of modern medicines many a times lead to lot of side effects in such cases. Now, for us, we have lot of cases which have been treated successfully, and everybody in homeopathy must be having so many cases of rheumatoid arthritis or any other systemic disease with the articular manifestation treated successfully, and we all have our success stories. But what I am sharing with you today are those remedies, especially when our case gets stuck. For example, we all have those kind of cases where we have treated the patient for maybe few months and the patient gets stagnated, in the sense you don't have a relief after 50% recovery. You have repeated the remedy, you have changed the potency, and it has not gone ahead. Now in such conditions, there are some remedies where you can think differently and they come to our aid to take the case a level ahead. These remedies we have used clinically and verified and have helped us in our clinical practice. This is what I am going to share with you today. One of the remedy that we use commonly is Bacillus number 7. The very outstanding symptom of this remedy is a kind of mental fatigue which the patient has. I am talking about a mental fatigue in a patient of rheumatoid arthritis. It is very common to see a patient with a physical fatigue. This patient is mentally tired, and even a slightest job to even think tires him off. It is generally with lot of GI symptoms like flatulence, a sense of fullness which will appear like lycopodium, and it is a very good remedy in fibrous rheumatism. Now, fibrous rheumatism is clinically seen or verified when you touch the musculature of the patient. We have patients with articular rheumatism, especially where the joints are painful, and we have patients where the fibrous tissues around the neck, on the back, they become painful. Such patients with fibrous tissue inflammation along with gastric symptoms which is something similar to lycopodium, and when you see him, you see a kind of a prematurely senile person who comes with swollen joints at the level where the ligaments are inserted. That is, even in case of osteoarthritis, this remedy actually opens up the case for you. So this is Bacillus number 7, where you can sum up like a mental fatigue with a flatulence and a prematurely senile person. When is stuck, you can use this as an intercurrent remedy or maybe a remedy to open up the case. Another remedy which we generally use in case of a urinary complaint, which I have found useful in rheumatoid arthritis also, or in rheumatic complaints. Whenever you come to a situation where you see 2 or 3 systems getting affected and the symptoms either alternate with each other or they present together, and you are tempted to take those symptoms which bother the patient more, but there are some silent symptoms which are always present but they don't come to the extent where the patient gets disturbed because of it. So for such cases, for example, where there are wandering radiating pains, which is typical of rheumatism in fleeting arthritis, hepatic and rheumatic affections together, a past history of jaundice or past history of hepatitis any time before, due to any reason, even hemorrhoidal complaints along with rheumatism, you can think of Berberis vulgaris. And accidentally, many a times you have found that these patients also have gallstones or a renal calculus. A patient with these things coming as pathologies together, Berberis vulgaris will help you to enhance the effect of your remedy which you have given before. Another interesting remedy which I have found and used is Apocyinum andro. I'll tell you a case which I remember with this. There was a young child with juvenile rheumatism, and he used to have episodic rheumatic pains, where during the pains the patient used to drop his both the arms together, the limbs together, and he used to scream in pain, cry in pain for a long time, till the time he is not given painkillers. When I took the history, the mother told me something very interesting, that since the time he was 6 months of age, we have been giving him a medicine for worms which our allopathic doctor had prescribed, and after giving that, the patient responded well to the medicines, or he did not have these episodes of pain for a long time. Now this was very interesting. Why a medicine of worms will help a patient of rheumatism? Okay. And another interesting part was, how did he develop worms at such a young age, where he is generally not even bottle fed? So this made me search for a remedy which has rheumatic affections, drawing pains and worms. While going through these remedies, I came across this remedy Apocyinum andro, where Dr. Borick writes, the rheumatic symptoms of this remedy promises curative results. Its pains are wandering in nature with much stiffness and drawing. That is what the child used to do. Everything smells and tastes like honey, and then he writes a full stop and writes worms. With this hint, I prescribed Apocyinum andro in that patient and patients after that, with good results. Whenever a patient has rheumatoid pains, rheumatoid joint affections, following a history of worms, this remedy breaks the barrier of your constitutional treatment and takes your constitutional remedy a level ahead. Another remedy that I want to speak to you about is guaiacum. Very interesting remedy, very helpful remedy, and there is a way to look at this remedy. First, it is an excellent remedy again on fibrous tissue, where you need to feel the muscle fiber which is tender generally, not like the articular rheumatism what we see in rheumatoid arthritis. Here the muscles are inflamed, here the tendons are inflamed, and the patient has a severe stiffness where he flexes his joints to keep himself feel better, and he will stretch the same thing to relieve him. Stretching ameliorates and cold application ameliorates, which is typical of ledum pal. Whenever you have a patient talking about cold application ameliorates, the first remedy that comes to your mind is ledum pal. But if it is a fibrous tissue rheumatism, along with slight stretching ameliorates and applying cold ameliorates, always think of guaiacum. It has really solved good cases which have been stuck for a long time. One of the commonly used I call them as a blockbuster when in case my case gets blocked, is a remedy called Kali Iodatum. If you read it from Phatak, this is exactly what you see in patients. It is a very good anti-syphilitic remedy, and it again acts in fibrous tissue and connective tissues. And he writes very interestingly, diversity of lesions, diversity of aggravations, with many tedious symptoms, without any one feature being in prominence, calls for this remedy. The next line he writes, stubborn chronicity. I always see this remedy like this. For those cases who have been stayed in your clinic for a long time and not moved at all, stubbornly chronic, and you try to take the modalities and symptoms, you don't come to one remedy. There are many remedies pointing to it because it doesn't have a consistent aggravation and a consistent amelioration which will make you come to the remedy. This remedy, if given in such a situation, really works wonders. In fact, it can give you curative results to your stuck cases. So important is Kali Iodatum. Another important remedy which I have used, especially in elderly people, is lactic acid, where the patient generally has a combination of diabetes and rheumatism. Whenever a patient with diabetic history and rheumatism comes to you, never miss this remedy, lactic acid. He will often tell you about this morning sickness, that a feeling of nausea in the morning, and this is the generally a keynote to enter this remedy. So whenever you see two diseases coming together, the way I told you before of GI complaints with rheumatism, you have bacillus number 7. Same way, if you have diabetes with rheumatism and a morning sickness, you can think of lactic acid. The another remedy which I have used, especially in rheumatism with bronchial complaints with urticaria like symptoms, is Pinus sylvester. This patient emotionally is actually burdened with guilt and self-approach. He has emaciation of lower limbs and weak ankles, as we see in abrotanum. But in abrotanum, you have the discharges which have been suddenly stopped and fleeting arthritis. Okay, in this cases, in this patient, you will have rheumatism with bronchial symptoms and the same appearance of an abrotanum child. When you see an abrotanum child with urticarial symptoms or bronchial symptoms, the remedy can be Pinus sylvester. Now these are the remedies which has helped me in my clinical practice in treating rheumatic complaints whenever they were stuck, and I thought that I should share with you so that maybe if you are also having a similar difficulty, this will help us clinically come to a better level in treating rheumatoid arthritis and conditions like that. There is lots to be told in rheumatology, but this is just a tip of the iceberg. Happy rheumatology to you.